The Republicans in Congress have threatened to repeal the Affordable Care Act expeditiously. If they repeal and do not immediately replace the Affordable Care Act, if they so-called repeal and delay, it would create havoc and significant disruption in the American healthcare system. First, let's just take the issue of coverage. If you repeal the Affordable Care Act, and in particular, repeal the mandate, repeal the subsidies which allow people to buy insurance in the exchanges, it would totally disrupt the individual insurance marketplace. Without the exchanges, lots of people will lose their coverage. It's been estimated by the Congressional Budget Office, the Urban Institute, that tens of millions of Americans would lose their coverage. In addition, the insurance companies would pull out of the total individual market, including that part of the market where people buy insurance without subsidies, because they would see this part of the market as dying. Congress would have said that they're not going to provide subsidies. In addition, the provision that the insurance companies have to provide coverage to individuals who have pre-existing conditions but don't get compensated for it fairly would mean that they would stop selling insurance in large measure to individuals. The result is lots of people without insurance. It also turns out that that situation of repeal and delay would actually be financially ruinous. While it might save on the subsidies, it turns out that actually it would raise overall costs and increase the federal deficit. One of the secrets is that the Affordable Care Act actually pays down the federal deficit. It more than pays for itself. If you repeal the Affordable Care Act and you get rid of the funding mechanisms, the federal deficit will actually go up. Finally, lots of people think, well, I have insurance through my employer. Most Americans have insurance through their employer. A lot of Americans have Medicare. Repealing the Affordable Care Act won't affect us. Far, far from true. Many people who lose their insurance will still need health care. They'll go to emergency rooms, they'll go to doctors, and they will get care, but they'll not be able to pay for that care. It becomes what is termed in the field uncompensated care. Care provided by hospitals but not paid for by individuals. Hospitals will still have to recover the cost of that care. The way they do it is by cross-subsidization. They actually bill people who have insurance to provide free care to individuals who don't have insurance. That means that our premiums for all of us who actually get employer-based insurance would go up, and we would see an increase in our premiums because of repeal of the Affordable Care Act. In this way, the Republicans' proposal to repeal the Affordable Care Act but not immediately replace it would actually affect all Americans, those who are in the exchanges and those who have employer-sponsored insurance. Finally, repeal of the Affordable Care Act might actually spark a new wave of healthcare inflation. There are many things in the Affordable Care Act that actually hold healthcare costs down. New experiments with how to pay doctors differently, cost reductions given by drug companies, insurance companies, and those would go away. If, in fact, that happens, healthcare inflation could return, and again, that would affect all of us by increasing prices in healthcare and increasing, therefore, healthcare premiums. Repealing and not immediately replacing the Affordable Care Act would create a lot of disruption and chaos in the individual insurance market, and all Americans would be adversely affected by that policy.